Good afternoon. Welcome. This is Mr. Dibo. This afternoon we'll be discussing pre-operative care you consider when lighting emergency pre-op. This is part 2. It's a continuation of part 1 we discussed. So let's get started. The headings you consider in part 2. The first heading is physical examination. So it's a continuation. We ended on point 18. Now we are starting with 19. Physical preparation. So you make a very big heading under physical preparation, and the following are the next thing you should consider. After physical preparation, consider now new orally or new peolo. If at all you forget the two, you can go for nutrition. Now, under new orally, since it's an emergency, the patient should be taken to theater under empty stomach. So here tell the examiner to say, I will keep my patient new orally. So meaning the patient should not take anything by mouth, okay, to prevent aspiration pneumonia. Now if the patient had eaten and then he or she was in this situation, consider aspirating so that the patient can be taken to theater on empty stomach. And then skin preparation. Under skin preparation, consider the following. After writing skin, write the following: wiping. So under wiping here, you don't necessarily need to bath the patient since there is no time, being an emergency. Consider simply wiping the patient to remove dirty or any blood stained or any infections. Quickly wipe the patient and prepare them for theater to prevent infections. Then the other heading under skin is shaving or local site preparation. It's very important, depending on the hospital policy, that the patient is shaved. Shaving will stop or prevent harboring of infections. Then after skin preparation, write about dentures or artificial body parts. Now dentures and artificial body parts need to be removed. For example, certain body parts like artificial limbs, you don't need to go with them in theater. It's very important that they are removed to prevent choking. Not only are you going to prevent choking, certain dentures like rings, when they are removed, they help to prevent electric shock from deafening. Okay. Then other artificial things you can remove with things like polish, nail polish, lipstick, for easy monitoring of cyanosis during surgery. So consider removing all the artificial body parts for various reasons I have mentioned. Then move to gowning. Gown the patient in clean, sterile, okay, theater gown to prevent cross infections. Then label. Labeling is very important. You need to label the patients for easy identification. So the identification bands should have the name of the patient, the operation, the ward, the sex, and the diagnosis, even the type of procedure, inclusive of the date. So all such information are very important for identification and to guide on specific procedure to be done on patients. Then move to bladder care or catheterization or elimination. Now under bladder care, Here you need to make sure that the patient goes to theatre on empty bladder. This is very important to prevent accidental perforation of the urinary bladder in case of abdominal surgeries. Then we move from there to pre-medication. Now under pre-medication, the anesthetist or the surgeon examines the patient and they give certain drugs like antihypertensive just to stabilize the patient and to avoid complications after operation. Other drugs they do administer are drugs like atropine to reduce on secretions, therefore preventing aspiration pneumonia. Then from there, you need to do your baseline vitals. These are vitals which will act as baseline data when you're handing over the patient to theatre personnel. Then gathering of the patient's file. It's very important that you gather all the patient's file. Gather this patient's file, all the X-ray charts, and take them to theatre with the patient. From there, transfer the patient on a stretcher. Make sure that the patient are in good condition even as you are transferring them. Then after transferring, make sure that you include your handover with clearly stating the patient's condition and all the necessary details to the theatre team when you are giving the handover. Then now come back and make a post-op bed. Now you come back to make a post-op bed in anticipation of the patient's turn. So here we show the great faith to say the patient is coming back. So in expectance or in anticipation of the patient, make sure that you make a post-op bed. So this has been emergency pre-op part 2 in terms of headings. Remember, I was just given headings which you should consider when you are writing an emergency pre-op. Thank you very much. Subscribe for more videos and share our videos. This has been Divo taking you through emergency pre-op. In case of any question, you can drop the comment or the question in comments below. Thank you very much. Enjoy the rest of the day.